Okay, welcome everyone. Just as a reminder, please take your IDs off, put them in your pocket, and we're going to be lining up in groups over on the far left here. So if you see, for instance, as residents, then the residents please line up as you see the section indicated. Thank you. All right, well, welcome everyone. Welcome to the 2022 graduation and awards ceremony for the Department of Pathology. It is simply absolutely wonderful to be able to do this in person. It is great to see everyone, although we all have our masks on. And those joining virtually, thank you for joining us. This has obviously been another extraordinary year, a year that has changed the way we practice medicine, has changed the way we teach, has changed the way we do research, but it fundamentally has not changed who we are as a department. In fact, I think it's sharpened or heightened who we are. The collegiality, the collaboration, the giving of this department is extraordinary. I'm so deeply proud of the many ways everyone in the department, the staff, the students, the residents, the trainees, and the faculty have responded to the pandemic, have stepped forward, doubling our work effort, have stepped forward with creativity, and have stepped forward, most importantly, with collaboration and collegiality, helping each other out. It's been a simply extraordinary year in which the department has risen to the challenge of the pandemic. And I'm deeply proud of everyone who's graduating tonight and who's receiving an award. It's a particular accomplishment to do so during the pandemic. So my heartiest congratulations. I wanted to have a special shout out to our two chief residents. Where are you? Over here, Kaylin Davis and David Pesky, and to our chief graduate student, Andrew Wilson. They have just done an extraordinary job leading during difficult times, recruiting classes. I think for residents we had 13, and for graduate students 6. Selecting who could be interviewed, interviewing them, following up with them on multiple occasions. Their tireless efforts have brought just great incoming resident and graduate student classes. So thank all three of you for your hard efforts from me. We have a long program, and after please join us out in the courtyard. I think there'll be box meals served at that time. So with no further ado, let's start with the residency program. I'm going to ask Dr. Charles Steenbergen, director of the program, Aaron James, the co-director, and Alicia Ware to come up to the podium.
Okay, well, we want to welcome and congratulate our graduating residents. It's been a rather unique training experience for you all with the pandemic coming in the middle, but I think you all have done extremely well, and you're a wonderful class, and I'm going to miss everybody very much. I'm at least glad that we can do this in person this year. So so I want to acknowledge all of the graduating residents. We'll do it alphabetically. So Yember Ahmad is the first resident, graduating resident. She's leaving us to go to Boston as a fellow in transfusion medicine at Brigham and Women's Hospital. Next is Monica Butcher, who's also leaving us for a fellowship in breast pathology at Northwestern. Next is Kelly Craven, who's also leaving for fellowship in molecular genetic pathology at Memorial Sloan Kettering. Next is Caitlin Davis, who's also leaving for Hematopathology Fellowship at the University of Pittsburgh. Step up on the X. Next is Curtis Gravenmeyer, who's leaving for fellowship at Moffitt Cancer Center in Florida in hematopathology, to be followed by fellowship in cytopathology. Next is Eitan Halper-Stromberg, who's staying here for fellowship in molecular pathology. Next is Alice Meese, who's staying here as a surgical pathology assistant next year. Next is David Pesky, who's staying here as a hematopathology fellow next year. Next is Carla Saud, who's going to do a cytopathology fellowship here next year. Next is Julie Stein-Deutsch, who's staying here as a dermatopathology fellow next year. Jason Van Roo is leaving to be a medical examiner fellow in Miami-Dade County next year. And finally, Sintawat Wangsiri Shaharan, who is going to be a fellow at MD Anderson in Houston next year.
A number of our residents completed our residency certificate tracks, so I will be announcing them now. I'll start with the education track. First, we have Dr. Yember Ahmad. Dr. Monica Butcher. Dr. Caitlin Davis. And Dr. Alice Meese. have Global Health and Dr. Yember Ahmad. Next, we have Healthcare Policy and Administration and Dr. Jason Van Roo. Next, we have our Informatics track, Dr. Kelly Craven. And Dr. Eitan Halper-Stromberg. And then last we have our Physician Scientist track, Dr. David Pesky. And Dr. Julie Stein-Deutsch. Congratulations, everyone.
Next, we want to give special recognition to our 2 chief residents from this year who did an outstanding job dealing with the pandemic, also setting up the moonlighting process and also working on improving the CP call. So and in addition to that, recruited the largest class of interns we've ever had. So we really, really appreciate all of the efforts that you have made, and we want to recognize you now. First, Caitlin Davis. However you want to do this one. The second chief resident is David Pesky.
Thank you all for the recognition, and now it's our turn to recognize the people that we have worked so hard with. And we love giving out these teaching awards, which are voted on each year by the residents. But honestly, it's hard too, because there are so many amazing educators that we get to work with. I, for one, know that I would not be anywhere near the pathologist, or almost pathologist, that I am today without so many of the amazing faculty members and people that are here. But the residents do end up having to pick one, and so we're very happy to honor them today. And we also want to share some of the stellar comments from the residents that made each winner stand out this year. And our first award is the AP Faculty Teaching Award. And the winner this year is Dr. Lisa Ruper. Dr. Ruper is always accessible, always approachable. She'll donate her time to talk about whatever you need, a slide, a gross, a project, or really anything else that's on your mind. Thanks to her, we all know our way around a laryngectomy. Her diagnostic approach is just so systematic and useful for trainees of all levels. She's just a wealth of knowledge. We're in so much debt to her as a residency program and a department. Thank you so much, Dr. Ruper.
Next, for our CP Faculty Award, I'm very pleased to say that we've awarded Dr. Karen Carroll. If she could please step forward. Dr. Carroll is an excellent role model. She models 3 separate and highly important skills. First, how to be an effective clinician and diagnostician. Secondly, to lead by example. And lastly, an effective management of a highly complex laboratory. She is the type of lab director that we all hope to be one day, and she is also fully available to residents. Whether that is calling her at 3 a.m. with a complex CP call, asking what feels like a silly question at microbiology rounds, or bringing a CP call issue to her attention that she handles so effectively. She is an absolute joy to learn from and work with. Thank you, Dr. Carroll.
Next is the Clinical Fellow Award, and our fellows are so integral to our department's clinical work and to our resident education. And the residents this year selected Dr. Wheelie Lee, one of our surgical pathology assistants, as the winner. Thank you, Dr. Lee. Dr. Lee is so warm to work with in surgical pathology. She's a highly skilled pathologist at the scope, and she's really contributed to our education. She always makes a point to follow up with residents on tough cases to make sure we never miss a teaching point. So thank you so much, Dr. Lee.
And next, I'm very pleased to announce our Gross Pathology Award goes to my co-chief, Dr. David Pesky. The Cutter Buddy role is filled by a senior resident who patiently and steadily teaches and assists new interns as they start grossing specimens on SP and Gyn rotations. A good Cutter Buddy has skills of methodically walking through the grossing procedure, providing the intern with useful feedback, and then also occasionally showing them a better way. Dr. David Pesky fulfilled the Cutter Buddy role just like this and performed it the most this year of any resident. All through his time here at Hopkins, he has been quick to fill the need for Cutter Buddies, and this year, while he was extra busy as chief, continued to do so. He teaches patiently, even in the face of a cystic prostatectomy that had 43 metal rods in the prostate that had to be pulled out one by one. And he's an excellent teacher and quick to throw in a joke to keep things lighthearted amidst the busy gross room. Thank you, Dr. Pesky.
Thank you so much. And now it's my turn. This was not rigged. But I'm extremely pleased to announce the next award. It could not go to someone more deserving. It's the Resident Teaching Award, which this year is to my co-chief, Dr. Caitlin Davis. Caitlin cares so much about resident well-being and education. She is always eager to help and is extremely patient in teaching residents nonstop. More than one of our resident voters said, "I have never met any resident who cares more about helping out her co-residents than Caitlin." And let me just add that personally, I have been continually impressed by your tireless passion for our program, and you bring out the best in all of us. I couldn't have dreamed of having a better co-chief. Thank you. This one's yours.
All right, last but very much not least, I am very pleased to announce that our Staff Appreciation Teaching Award goes to Alexandra, or Allie, Webster, one of our surgical pathology PAs. Allie constantly makes herself available to residents, whether that is to assist with numerous frozens or answer questions on how to approach a specimen. And she does this all regardless of how much work she has piling up at her own bench. She is a wealth of knowledge and is always approachable and happy to help. She is a leader in the gross room and regularly advocates for improvements. We appreciate how she is available when we most need it. Thank you, Allie.
Congrats again to all the award winners for the residency. Thank you so much for all the teaching you did to us, whatever. And now we wanted to just briefly reminisce on our time at Hopkins and our time this past year specifically. One thing I always think about with Hopkins is a simple wisdom that one of my medical school mentors told me. And when I was deciding where to rank residency programs, we talked a lot about the pros and cons, all the different variables of so many different places. But when we got to Hopkins, the point he made was simple and quick. It was like, well, Hopkins, I mean, they're just the best at everything. And that made my decision easy, honestly. I fortunately was able to match here. You all took me in, and now here we are 5 years later, and I've seen how much truth there is in that statement. Hopkins really has been the best for me in ways big and small, and in ways that I expected and in ways that were unexpected. Whether it was learning histopathology at the scope with all of our best attendings in the world, whether it was working in the research lab as a fellow with the best scientists and mentors, it's just amazing the training opportunities that we have here at Hopkins. They're truly unparalleled. But what's going to stick with me forever is how fortunate I've been to work with so many amazing people at all levels of the department. Even before I arrived here in Baltimore, Nancy and all the staff at Path Training Office made sure that I didn't forget to cross any T's on any of my important paperwork. Somehow they've managed to do the same thing for us year in and year out. Down in the depths of autopsy, our resilient tech Alex never complained about starting the 4th case of the day, and he put up with listening to some very trashy pop music. That's assuming, of course, that Mark Hopkins didn't get to the radio first and put on NPR. But if it was me and Karen, it was Justin Timberlake. And he never judged my singing voice either. And in our grocery room, our superstar PAs, they never rolled their eyes when I still couldn't find that second ureter on a cystoprost or rapid gross. They just patiently helped me find it again. And of course to all my co-residents, without you and without your help, I would still be cutting Gallia's 57th frozen section. I would still be sorting through another tray of SurgePath slides, and I would definitely still be buried under a pile of incorrectly filled out autopsy consents. And perhaps most importantly, without you, I'd just be the dude singing off-key karaoke at the bar by myself. So thank you for being there to sing with me. Thank you for all your support this year and all the years that I've been here. And I know that no matter what changes take place here at Hopkins, you guys will always be the beating heart of our great residency program. The fact that we trained at Hopkins, which truly is just the best at everything, will always be a badge that we can wear with honor. So thank you so much. And there have been many changes. It was another year of navigating through a pandemic, but honestly it felt like we were able to handle whatever curveballs came our way brilliantly. The epidemic curve maybe rose and fall, and we just sort of integrated what needed to be done into our daily routines. And so I know that one day whenever the Omega variant or Andromeda strain or whatever shows up, Nancy will just call you and get whatever N95s and hand sanitizer we need. Thank you so much. And we truly did embrace the continual adapting to everything that we needed to do. We rolled out hybrid conferences for microscope-based teaching sessions to allow for people to attend however they felt most comfortable. For our intern conference, this was really done with the help of a fully digitized slide set. Thank you so much, Abby, for generating that for us. And we were able to embrace all the possibilities afforded by digital learning. Dr. Wu, who works remotely at Sibley, established a great HemePath teaching session that just complemented other rotating conferences we already had in SP and Gyn and pediatric pathology. I know that one of my favorite new activities was just learning at the scope with my peers directly for our weekly BYOG, or bring your own glass. And if you didn't have any glass to share, you could always just BYOB. No, not beer, just bring your own body, and you'd be able to pick up pearls from your co-residents about the great cases that we see day in and day out around here. A huge shout out to Gabrielle and Harsimar and Abby, who helped lead and spearhead the establishment of our wonderful Welsh Weekly newsletter. I look forward to receiving these beautifully designed updates full of important information and all of the great photos about what residents were up to every week. And no matter what, we definitely found a variety of ways to have fun together. We were fortunate to be able to dust off some great traditions this year. We had an annual welcome dinner for our new interns that was on the harbor, a fantastic event arranged by Julie. Here you can see in the top left corner, that's Eric. He's trying to convince us that his mustache is like as glorious as Sir Osler's, but we're just not buying it clearly. And there were so many other events that kept us together and going strong. Thank you to everyone who participated in organizing them for us. Nancy and the PTO got us out to our annual game at the Orioles. Sina established the Johns Hopkins beach volleyball team, named, of course, what else? The Cutter Buddies. And Caitlin got us out on the water, whitewater rafting in West Virginia. I really like this picture. Harsimar here, you can see her just thinking, oh yeah, one day I'm going to be chief. Kelly got us all out for a round of Topgolf, and again, thanks to Kate, we were able to get on the water here in our very own harbor for a great sunset sail in the Pride of Baltimore. And I love that our program has always done its best for our parents and families, mine included. And my boys, for example, loved the day we all spent carving pumpkins at Patterson Park. So thanks, Monica and Gabrielle, for organizing that memorable experience.
In the area of COVID, it's always been a challenge when we can't always meet together and have our normal dinners and things like that, to still have festivities during the holidays that come to the level of those expectations. And the Wellness Chairs and Wellness Committee have done a phenomenal job for 2 years now of having different holiday activities that make the time really fun and commemorative, as well as also having a photo taken outside with all of us, a hot cocoa cart with all of the fun fixings and delicious delicacies, and some holiday crackers that end up being a really fun endeavor to crack open and then wear your hat all day. So these are just some of the things that our wellness group has done to continue to enjoy these times with COVID. Additionally, something that's come in recent years is also celebrating each resident as they finish that final SP rotation. After 7 long block sod SP, then coming to a close, celebrated with different beverages, sparkling grape juice, and cakes and things along those lines to celebrate and commemorate the completion of an era. And also this year, we were able to go to USCAP for the first time in some time, as many of our conferences have been remote. And as a trainee, it's a little less fun to sit in a virtual space and wait for someone to hopefully come by so that you can talk a little bit about your poster, rather than this allowing us to go back to having those conversations and collaborating and getting to discuss your work with people. And everyone did a really great job. We also wanted to discuss some of the ways that, particularly this year, amidst challenges, that residents stepped up and did a phenomenal job of meeting gaps, and bringing a lightness to the year that we really needed. So surgical pathology moonlighting was something that was established early on, but then tweaked this year to meet a need. We had some short staffing in the gross room, and you can see that this is a long list of residents who all contributed as moonlighters. And I also wanted to specifically mention Andrew, Jason, and Sintawat, who all moonlighted consistently throughout the year, and their contributions were significant to helping in the gross room and completing those less educational specimens so the residents had time to focus on the educational ones. We'd also like to thank, in that light, Dr. Lisa Rupert and her contributions to also keeping this moving, as well as our residency leadership, and also prior chiefs, which includes Dr. Alicia Ware, who actually brought some SP Moonlighting to light a few years ago and allowed us to be able to just tweak something that existed already. Now also, Autopsy Moonlighting also came to be this year, and this was established in August also due to some short staffing, and we also had many residents that participated in Autopsy Moonlighting. Now I have to say that I call this one quite a feat because they had to don those scrubs again and return to the autopsy suite when you were logged on with those rotations. And so these phenomenal residents came back and performed additional gross dissections of cases to fill in gaps and give some of those interns the needed break on the weekends. And also, we wanted to commend our PAs, Allie and Nathan, who both performed cross-coverage from surgical pathology into autopsy and helped teach the interns on how to gross those cases at the beginning. So our Cutter Buddy system has been long-standing, but this year is like any other. We had phenomenal contributions from our senior residents as well as the senior SP residents helping out the interns as they became accustomed to the gross room. And everyone did an incredible job of pitching in and helping out when it was needed. So for recruitment, as Dr. Steenbergen alluded to, we recruited a very large class this year. And so it was another fully virtual recruitment process, and we interviewed 88 applicants. This is more than, at least in my knowledge, we had recruited in quite some time. And for each one of those applicants, the PATH training office did a phenomenal job of sending them a Taste of Baltimore box, which had some different goodies and trinkets from Baltimore that they could experience since they couldn't be here. They also, each applicant had a faculty contact, and we want to thank all of you who performed that role, because I think it made a tremendous difference, as well as a resident contact. And then beyond that, they also met with groups of residents virtually in 2 different times, and met about 8 residents as well to allow them to really get a good feel for the program. And we think that overall, those kinds of extra efforts that were put in were tremendous in recruiting a really excellent class. We had 22 interview days overall, 7 of which were physician scientist days, and over 90% of our residents participated in recruitment, and thank you to all of you. Additionally, we had a recruitment tour video that was piloted by Gabrielle and Caroline to show these applicants what our hospital looks like in some of our favorite spaces. And so we just wanted to show snippets of some of the locations that we showed them and our different residents that participated in making this video, as well as to PATH Photo for helping in compiling it and putting it together and giving us instruction in how to make this the best it could be. So then after all of that effort and such a phenomenal contribution from so many people, we have an excellent new intern class of 13 that will be starting with us in July. 12 of them are either AP only or AP-CP, and then we have one, the last one on the list coming in is AP-NP. We also have some new wellness leadership, and in the era of COVID, our wellness committee has been absolutely essential to providing meals and helping keep resident morale up. And so we want to thank those who are outgoing, which will be Gabrielle and Monica, for their tremendous contributions, and some applause for them. Thank you very much. Katya will be staying on as a continued wellness chair, and we also have incoming Abby and Lorena, who will also be starting. And we know you're all going to do fantastic things in your role. We also wanted to specifically thank Dr. Alicia Ware. So Dr. Ware will be leaving us this year, and we cannot let her go without thanking her for the immense contributions she's had to our residency program during her time from residency to now as faculty and as associate residency director. She established the Wellness Committee right before my intern year, and I remember how excited I was to be able to join in on that kind of committee and just the sort of thing that I wanted to get involved in. And she built that to blossom and then established it at a time that was so crucial, because then when we hit the COVID-19 period, we already had a really well-established wellness committee that could really do good things here. And she didn't stop there. She continued as faculty, as the mentor for the wellness committee, and as associate residency director, where she has taken time to help and hear from residents individually and improve on processes as a whole. She will be greatly missed, and we feel lucky to have had the opportunity to learn from her. So thank you very much, Dr. Ware. Now, just to wrap up, we wanted to first of all thank our phenomenal residency leadership, who have all done a wonderful job and been excellent mentors that I will never forget. That includes Dr. Steenbergen, Dr. Ware, and also Dr. James. And for their mentorship and support through this ever-changing COVID period, and through recruiting this really large class, and then supporting the residents through all of our ideas, both good and bad, and then also giving us feedback on how we can learn and improve and continue to grow. And also to the PATH training office, Nancy and her team. They have done such a phenomenal job with recruitment and just helping us with every little thing we need. And they have taken such good care of us this year and many years, and we could not have done all of this without them. So thank you to all of them. And I just wanted to leave you with some final thoughts, that though I've decided to leave Hopkins to train somewhere else, to get some new perspective, I know that many of my co-residents who are also leaving also agree that we will never forget our time here and the effort and energy that people have put into us for our learning and training, and also just what an incredible group of people that we have had the chance to know and to work with. There were so many twists and turns that have brought our time here to a whole new level, and I know that being here, I've learned to be much, much better than I ever dreamed I could be, and I want to thank you all for that. And I cannot wait to be a future faculty, coming to conferences, looking forward to seeing all of my Hopkins family and getting back together just like no time has passed. And I know that's how it will be. So thank you all.
I have to say, I don't know, you guys are all too young to remember Columbo, the old TV show, but the chiefs and the moonlighting remind me of Columbo. He was a police detective who wore an old raincoat, and it would always end with Columbo solving the crime by leaving the room, but just as he's leaving, he'd say, "Oh, just one more thing." And then he would point out, a cigarette butt that was a certain type, and the criminal would be standing there smoking, and you'd realize who it was. And with these two, it was always, with moonlighting, it would be, and just, we'd think we'd have it all solved, and as they're leaving the room, they'd say, "Oh, and just one more thing. Of course, with the moonlighting, you're going to pay us extra." And so they were very good at doing that on the way out of the room. So you should thank them both. But I did want to echo the words and thank Dr. Ware, getting a hug over there again. She's just a star. Now, we'll turn to the pathobiology graduate program, and I'll ask any graduates to stand up over there, and Lee Martin, the director, and Aaron James, the co-director, to come forward.
Thank you, Ralph. Dr. James and I are very pleased to announce that 4 of our pathobiology graduate students graduated with their PhDs this academic year. They are Lionel Chia, Yeyoon Jiang, Yeji Jiang, and Daniel Monaco. Lionel has gone off to Foghorn Therapeutics at Cambridge, Massachusetts to do a postdoc in a biotech company. Yeyoon has gone to the FDA to do a postdoctoral fellowship. Yeji Jiang has gone to Ohio State University to do a residency in anatomical pathology. And Daniel Monaco went straight into industry as a scientist, working at Immune ID. I would also like to announce that very proud of our second-year cohort. Nick Bachman, Stephen Brown, Megan Hess, C-Sim Kang, Mason Lowe, Amanda Lofton, and Ali Trujillo for doing an outstanding job on their doctoral board oral exams. I am very, very proud of you. You all did an amazing job. Thank you very much. And now I'm very pleased to announce the Chief Graduate Student Award, Andrew Wilson. He is an incredible phenomenon of an individual. He managed his laboratory work, his PhD thesis work, his laboratory with Tom Lloyd, and at the same time balanced his leadership and administrative responsibilities in the graduate program. Thank you so much for everything that you have done.
All right, thank you. So as Dr. Martin just introduced me, I'm Andrew Wilson. I'm a third year in the pathobiology program and chief resident, or chief grad, sorry, not resident. Don't have an MD, say that, for this year. And so our award that we give out each year is the Nancy Nath Pathobiology Teaching Award, and this is given by the students, voted on by the students at the end of the year for you know, a teacher that has, you know, gone above and beyond for the students and has showed great passion in their teaching. And this year is actually our director, Dr. Lee Martin. He gives a great amount of inspiration for many of the students. And really helps foster interest in fields that we may not be interested. You know, he's in neuropathology and shows great interest and really helps us explore these fields. And overall, just as a you know scientist, really helps us understand very complex topics. And we'll sit with you and talk to you for hours about, you know, various techniques, various studies, or just the, you know, the complex intricacies of the brain and really understanding this. So for this year, I'd like to announce the award for teaching award as Dr. Lee Martin.
I went to Stacy today and asked her if there was some mistake. Thank you. You're all an inspiration to me.
All right, so as the chief residents just did, I'll give a little short review of what's been going on in the pathobiology group this year. And as you can see, we really got to take a picture, which was actually my first picture. I started my first year right before COVID, and then COVID hit, and we weren't actually able to take a picture for my year. However, in this past last year, I was actually able to, and that was a great time to see students that we actually hadn't seen in a while in person. It was more, on a Zoom call. However, with, COVID continuing, there was more Zoom and more hybrid meetings that occurred, including our journal clubs. I want to thank Dr. Ben Larman and Dr. Scott Crumey for really helping push that forward and help us find faculty, and also all the faculty that helped being mentors to the students on the various topics that we discussed. And overall, just the students for really, participating and really getting good insight. We had our Wednesday lunch meetings. I put lunch in quotations because we used to have lunch, but with COVID, it was more, again, Zoom. But still, it was great to see, especially for our first years, see the different groups on campus and various faculty that they could be working with in the respective fields. Again, we had Thesis Seminars, as Dr. Martin mentioned, the 4 students that just recently graduated over this last year. And again, recruitment, as the chief residents pointed out, we also had a virtual recruitment where I will discuss that a little bit. And of course more. We did various other meetings, holiday festivities and celebrations within our cohort. And with this time, students were starting to get back into lab, unlike, last year where there was some time of lull within the lab, or, staying at home a lot and working virtually. However, many students contributed to a number of publications over this past year, so I just wanted to show and mention some of these publications that the students have worked on. So, good work, and you can see how getting back into the lab, we're actually starting to, get things going again, which is really nice. And with that, back to in-person conferences. Just this past month, 2 of our students went to the American Association of Cancer Research in New Orleans, and I want to point out Manali, who was actually granted a AACR Scholar in Training Award, so I want to say congratulations to her for all her hard work. And some other meetings where bowling can occur in a social environment, and this was at the ALS Packard meeting right here in Baltimore a few months ago. So it's really nice to see our students starting to go back to conferences and really be able to interact with people they may have not met before, or make new collaborations with other groups. And really, outside of lab, there we go. Outside of lab, we've been doing a number of things as well. In the top left here, you can see last month, many of the students went to the Cherry Blossom Festival, and I want to point out Harley Parker, the former chief grad before me, who also started as our social committee, and she was our social committee alone, so I wanted to say thank you so much to her. Starting to plan various events for the students to go, including this Cherry Blossom Festival. Even though it wasn't the warmest of times in the past month, it was still a great time. And as the chief resident showed, they have a volleyball team. Well, in that middle picture, it's kind of hard to see, but you can see me wearing a boot. I also do some Volo Sports with some of the other students in our program. However, mine didn't end well, and I actually sprained my ankle pretty bad. So that's me in the graduate room sitting there with a boot eating lunch. And we also, just this past year, got a new graduate room for the students to study, and that's actually where our second year cohort took their oral exams. However, we do like to have a little bit of fun, and you can see Harley and I playing air hockey on a small table, and we have this nice, large table for studying, but also ping pong. So, many times pulling that out and having some de-stressing with some ping pong. And many students, you can see in the bottom right here is an example of students attending the graduate formal, which happened last month as well. And just generally hanging out with, people that were in our bubbles, or if we could in mass environments, hang out together in our new graduate room. And as I mentioned before, we did also have a virtual recruitment, and I want to thank all of the students that helped with this event, either interviewing students or just being there to talk to students if they didn't have interviews, and also playing trivia. So this was our trivia night with the students, and we had a nice big cohort as well of students that applied and we interviewed. And we accepted 6, as Dr. Rubens mentioned earlier, and we have a great group of individuals ranging from really around the world, which is great. So I'm excited to get to know these students better and really, see what we can all do together. And finally, I just have some achievements, and as Dr. Martin mentioned, just a shout out to some of our graduating students this year. So first of all, our first year students, they've had a very interesting year, whether they have classes virtually in some aspects or in person in others. So being able to, juggle that demand has been quite tough. So I just want to say congratulations to them. They're almost done their first year classes. So they'll be finishing up this month to move on to starting to study for orals in the near future. And speaking of that, I want to shout out to our second years, or as I like to call them, our oral exam survivors. Dr. Martin mentioned this too, but Allie, Amanda, Nick, Mason, Stephen, Megan, and CSIM, great job with your oral exams. These individuals, passed with flying colors. They did a great job. And actually, when I was doing some mock oral exams with them, I learned things that I didn't know. So I want to say congratulations to them as well. And then something unique to Hopkins, as we all know, my cohort on time, actually, versus last year, got to do our graduate coding ceremony in person. So I just wanted to say congratulations to my cohort, and we actually were, able to take pictures together, and that was the first time I saw some of my cohort in over a year. So this was a great opportunity to catch up. And then, our 21-22 graduates, I also included a former chief grad who just did his thesis seminar in April, Peter, because I wanted to point out that, again, many of these students had virtual thesis seminars, and, it's nice that you can see individual or people that may not be able to join in person can visit, but it's nice to get back to this, hybrid meeting system where we can actually have some of these thesis seminars in person. So here in the bottom left, Peter is presenting his work in pancreatic cancer, which was very interesting. And, congratulations to all these students. I actually worked with a few of them and got to know their research, and they really helped me grow in the program, and I learned a lot from them, and I still talk to many of them today. So congratulations to them all, and as Lee mentioned, that we have some doing FDA work in the government to pharma to industry. So you see that there's a great wide range of work that these students or graduates actually are doing. And really just to finish up, I want to thank some of the people, aka our directors, Dr. Lee Martin and Aaron James. Thank you so much for all the hard work you do. Being able to talk to you guys with any problems that come up is really helpful. And I've learned a great deal from both of you, so thank you very much. And Stacy Marsh, she couldn't be here today, our administrator, but if I didn't have her, I would have lost my mind very quickly with everything going on. So I just want to say thank you to Stacy for, again, all the hard work she does, and everything that, if something was falling apart, I could go to her and she would help me figure it out very quickly. So thank you, Stacy, so much. And then obviously Dr. Rubon, thank you for all your hard work and really showing that you really care about our program and helping us through some difficult times with COVID. It's been a great honor getting to talk to you every month. And Ellen Winslow for all her hard work, again, helping me schedule and really, pushing our journal club to a wide audience for whoever wanted to join, they could. And Ellen, thank you for helping me schedule everything and really working with me. And finally, as kind of is tradition, we like to leave it to thank you to all our, as we say, patho pets. With them, we wouldn't survive. They keep us sane. They're great to go home and snuggle with after a long day in lab or even a long week in lab. So these are a wide range of various animals that help keep us sane. So I just wanted to say thank you to our pets too. So thank you everyone for listening.
Thank you, Andrew. Now we'll do the named awards. The first named award is the Joseph C. Eggleston Award for Surgical Pathology. Joe was the director of surgical pathology. He was a tough-as-nails surgical pathologist in the time before there was immunostains and molecular analyses, and he looked at a slide with minimal amount of tissue on it and could issue a diagnosis. A world expert in lung cancer. And this year's awardee is Eric Young for genomic profiling and esophageal neuroendocrine neoplasms. The next award is the Grover Hutchins Research Award. It's for support for trainees and junior faculty in autopsy, cardiac, and pediatric pathology. Dr. Hutchins was an outstanding autopsy pathologist, the director of autopsy pathology, and a real leader in cardiac pathology. And this year's awardee is Tajan 1 for characterization of atherosclerotic, atheroprotective macrophages in coronary artery disease. Tajan. Okay, the Gary Hill Award in renal pathology goes to Abdul Rahman Al Abdul Salam. And Gary was a renal pathologist here who also directed Bayview Hospital Pathology. Next is the Risa Mann Award in education. Risa was an extraordinarily gifted surgical pathologist and a leader in hematopathology, and also a wonderful educator who directed our residency training program for a number of years. This award supports a resident for education projects. And this year's award is Eaton Halper Stromberg for his work, digitization of whole slide images for educational use on the molecular pathology service. Next is the Fred and Janet Sanfilippo Award. Fred and Janet, Fred was the seventh director of the Department of Pathology, recognized for his work in the immunology of transplantation, particularly xenotransplantation, and Fred transformed the department under his leadership. This year's awardee is Thomas Zykos. He cannot be here today. He's in Canada, but his award is for characterization of cannabinoid receptor density and distribution in human brain autopsy samples in HIV-infected individuals. So thank you. Congratulations, Thomas. Next is the Mabel Smith Award for Resident Research and Education. Mabel was a much loved and revered administrator in the department who the department directors thought they were running the department. It was really Mabel running it. And this year's awardee is Eric Young for his work in genomic profiling and esophageal neuroendocrine neoplasms. Awesome. And here's the Gary Hill Award, which I mentioned earlier. Next is the Quality Initiatives and Performance Improvement Award, and I'm going to ask Dr. Bill Clark to give this.
So it's my pleasure to give this Quality Initiatives and Performance Improvement Award. The topic for this award, or the subject for this award, has already been discussed a little bit in length in the year in review, but it's what I thought was a really creative but practical solution to a pressing problem. And so that award is given for the project Resident Moonlighting to address PA short staffing in the SP gross room, and that award goes to Caitlin Davis. Faculty sponsor was Lisa Rupert.
The next award is granted to the William H. Medical Student Awardee. This award is awarded annually to a medical student who exemplifies excellence in pathology. This year's recipient is Michelle Colbert. She's unable to be here tonight, but Michelle was a fantastic medical student rotator who rotated with us as a second-year medical student, had an outstanding performance during our virtual elective, and has continued to be involved with pathology since then. She has matched for her preliminary in internal medicine and will be doing a dermatology residency at Mayo Clinic following that. Thank you.
Next, I'll ask Dr. Aaron to do the fellowship programs.
All right, Dr. Roden couldn't be here this evening, so I'll be doing both clinical and research. In autopsy pathology, we have Jen Liu. We have more?
No, go ahead. I did things a little bit out of order. Let me just acknowledge there are some named fellowships that we should recognize. They're up on the screen. They honor our faculty at the same time as supporting our fellowships. So you can see 8 of them here and another 5 here. These are wonderful ways to support our programs in each of the different divisions. So, go back. All right.
All right, now in clinical chemistry, Li Wei Cao. Cytopathology, we have 2, Rana Aldriz. And again, in cytopathology, Efren Ribeiro. In gastrointestinal liver pathology, Mohammed Dabouk. No? Okay. Also, we have Takichi Yoshida. Not here as well, all right. And Neha Nanda. And also not here. Congratulations to them. In genitourinary pathology, Amir Hussein Akbari. Gynecologic pathology, Lim Ling. Not here, all right. Hematologic pathology, Nada Al-Kasi. Also hematologic pathology, Ankit Rajgaria. Immunopathology, we have Theodore Kau, no, not here, and Vitaly Rusinkevich. In medical microbiology, David Gaston. In molecular genetic pathology, Karen Miller. And not here, all right. And neuropathology, Bharat Ramlal, also not here tonight. Ophthalmic pathology, Mohammed Riggi. Renal pathology, Alana Dasgupta, she's unable to be here tonight. Transfusion medicine, Victoria Costa. And also transfusion medicine, Nicholas Mercure Corriveau. Urologic pathology, Aisha Fatima. Also urologic pathology, Jianping Zhao. Congratulations to all the fellows.
Next, I'll ask Dr. Lisa Rupert to come up and congratulate our faculty assistants. These are essentially fellows who do the work of faculty issuing diagnoses for our patients.
All right, hi everybody. So I'm very pleased and proud to announce our faculty assistants who, as most people probably know, come in, instead of doing a conventional fellowship, serve a faculty role. They have sign-up privileges from day one. They handle busy frozen section services, as well as handling, in some cases, busy consultation services. And they really, it's such a challenging year. They do such an exceptional job. And it's really rewarding, not only for them, but for all of us who get to work with them and watch them grow and develop as pathologists over the course of the year. So we have four different groups. We're going to start with our inaugural breast pathology assistant, Mira Latvala. She will be heading off to Moffitt Cancer Center, where she'll also be an assistant professor at the University of South Florida. All right, we will now move on to our gastrointestinal and liver pathology assistants, starting with Fengming Chen, who will be an assistant professor at Duke University. Next is Aslam Kulak, who will be an assistant professor at Thomas Jefferson University. And our third GI assistant is Jasmine Shen, who will be a pathologist at Pathology Consultants in Lafayette, Indiana. All right, next we'll recognize our gynecologic pathology assistants. First is John Anderson, who will be a chief of gynecologic pathology at Maimonides Medical Center and assistant professor at SUNY Downstate. Brian Finkelman, who will be Assistant Professor at University of Rochester Medical Center. And finally, we have Ying Liu, who will be doing a surgical pathology fellowship at Stanford University. Finally, we have our surgical pathology assistants, starting with Erin Baumgartner, who will be a pathologist at Summit Pathology in Fort Collins, Colorado. Next, we have Wheelie Lee, who will be a genitourinary pathology fellow here at Johns Hopkins. Next, we have Monica Nageshwar, who is deciding between excellent private practice options here in Baltimore. And finally, we have Kiki Yu, who will be doing our breast pathology assistantship here at Hopkins.
And now I'll ask Ben Larman and Charles Steenbergen to come up for the Pathology Young Investigators Awards.
So I want to start by saying that Ben really is the one who was the faculty person who ran the Young Investigator Day, but he's sick and not able to be here today. Secondly, I want to thank Stacy March, who's the one who really set up the virtual format, and without her, this would not have happened at all. And then I want to thank all the people who gave presentations and all the faculty who participated in evaluating the presentations. So we divide the presentations up into three categories, and we give awards in all the categories. In the first category is excellence in basic research, and the overall, the top-rated presentation that will be giving be a speaker at Grand Rounds coming up is Diego Lima. Other winners in the basic research category are Yan-Eun Bai, Chan-Soo Park, not here. David Pesky. Don't know what you're going to do with all these plaques. Cornelia Peterson. Manali Praharaj. Nelson Song. And Robin Welch, who looks like isn't here. So then the second category is excellence in clinical research, and the overall top-rated presentation who will be giving a talk at the Grand Rounds is Harsimar Kaur. Mike McCullough. And Tae-Jun Won. The final category is excellence in translational research, and the top-rated presentation will be, also a speaker at Grand Rounds, is Li Wei Cao. The other winners are Carly Jones, Kristen Malebranche, Esanka Precha, and Ye Wang. I believe that that's it for me. Yep. Okay, so thank you everyone for attending, and I think there's food upstairs. There's food up on the patio.